everyone, it's Philip here from Vet Education with the final installment from the WSAVA Conference in Suzhou in China 2024. And I just want to talk about parvovirus enteritis from a lecture that was delivered by Emeritus Professor Michael Lappin from Colorado State University. I want to touch on a few things. It was a great lecture, I have to say. Testing for parvovirus. Yes, it is possible to get false negative tests, if the animal's not shedding or if you're testing too late, those sorts of things. So it is possible to have a parvo positive patient that tests negative for your tests. Second thing I want to mention is that patients that are at risk for parvovirus enteritis, they are also at risk for intussusception and at risk for intestinal foreign bodies because they're puppies, right? So they do funny things. So make sure that your patient does not have an intestinal foreign body or does not have an intussusception. I personally have seen some dogs with parvovirus that have developed an intussusception at some point during their hospitalization. There have actually been patients who are improving and all of a sudden they start to vomit again, and we've palpated their abdomen and actually discovered an intussusception. So beware of that in your hospitalized parvovirus patients, that these things can occur, but you definitely want to rule out a GI obstruction early on in your patient management if the clinical signs and history mean that this might be a possibility for your patient. As far as treatment is concerned, really it's largely supportive in our patients there. We're going to give them IV fluids to treat shock and rehydrate our patients. Most of the time we're just using isotonic balanced crystalloid solutions. As far as antibiotics are concerned, we're going to use antibiotics in these patients most commonly because they are at high risk of sepsis and bacteremia. All right, so while I know one of the previous lectures we talked about antibiotic use for mild and moderate causes of diarrhea as having a strong evidence base against using antibiotics. For these severe cases, potentially immune-suppressed patients, which some of our parvovirus puppies are, these guys are at risk of developing bacterial translocation and systemic inflammation and sepsis. And so cefoxitin, which is a slightly broader gram-negative coverage, is recommended for those patients. You can also use something like enrofloxacin and amoxicillin. It was thought that just short periods of time with enrofloxacin, given most of these puppies are growing young dogs, and we know the damaging effects that enrofloxacin can have on developing cartilage, but short-term use for 4 or 5 days is not thought to be associated with an increased risk for our patients as well. So you can have enrofloxacin plus either ampicillin or metronidazole. For most patients, though, that are not septic, if you want antibiotic coverage for them, just a first-generation cephalosporin is usually sufficient for those patients. As far as other treatments are concerned, probiotics have oftentimes been talked about because there's a significant dysbiosis that occurs during parvovirus enteritis. We want to make sure that when we're giving probiotics, that our patient is eating and that they don't have diarrhea. Okay, so this is probably something that we're going to give to help restore normal biosis in our patient's GI tract, perhaps in that recovery phase, once that animal is ready to go home. Okay, the diarrhea stopped, the patient is eating well. If we give probiotics before this phase and we have this clinical illness going on with disordered gastrointestinal motility, potentially bacterial overgrowth in the gut, at this stage, there is potential risk that we could make things worse for our patients by giving them at that stage. Antiemetics, really, you can use 1, 2, or 3, metoclopramide, ondansetron, or meropitant citrate. Use the antiemetic. They all act in different ways, so you just keep giving them until your patient is less nauseous. As far as one of the big things is a lot of puppies have this disordered gastric motility, right? They have, it used to be called gastric paresis, we now call it gastric dysmotility, and that can lead to the stomach just sitting, not doing anything, filling up with a lot of fluid. Okay, so passing a nasogastric tube and suctioning this fluid out can reduce the sensation of nausea as well. And that's got an advantage in that we can begin some early nutrition with glucose and electrolytes, things like glutathione and glycine and those sorts of things in that microenteral nutrition solution we give our patients. And then we can begin, with an elemental diet or hydrolyzed diet down a nasogastric tube to begin with. And once our patient is tolerating nutrition, we can begin to feed them something that's a little bit more complex. Don't force feed your patients, okay? Give them food by a feeding tube, but don't force feed them. They will develop food aversions. They'll develop aversions to people in the hospital that are caring for them. Now, Dr. Lappin was talking about transfusion. About 20 mils per kilo of fresh frozen plasma can increase serum albumin concentrations by 0.5 gram per deciliter. Now, his recommendation is that in patients that are critically ill to consider using fresh frozen plasma early in your treatment protocol because it's potentially more beneficial before that protein gets really, really low in your patients, and that there may be some benefit in that based on his clinical experience. Interferon may be beneficial in these patients as well, but it is really, really expensive. It's not available everywhere as well. One of the advantages of looking at fresh frozen plasma is the provision of this passive immunotherapy. We don't have much data on it, again, as I said, but it may be helpful. So just consider giving it early. There are monoclonal antibodies available, and they might increase survival. And certainly studies on those have shown that there is less severe clinical signs. Again, they're a little bit more expensive. So plasma might be one thing. Granulate colony stimulating factors, not thought to be of any benefit at all. An interesting thing is fecal transplantation, which might be of possible benefit to your patients as well, just to help restore the microbiome in those patients that continue maybe to have a little bit of diarrhea in that post-treatment period. Now, there was a paper published a few years ago looking at treatment protocol for outpatient management of patients with parvovirus. This is mainly for perhaps our clients who are unable to support their patient in the hospital setting due to financial reasons or other reasons as well. And they found that 82% survival with Convenia as the antibiotic, long-acting antibiotic, subcutaneous fluids, once these patients have perhaps received a short period in hospital of intravenous fluid resuscitation, and then have subcutaneous fluid and meropitin. So this is something that's just not going to be able to fix every patient, but it's an option that certainly perhaps our more financially stressed clients can still be offered and with a potential good outcome, and they might still get their little puppy alive at the end of it. So that's what I had to say for you on the updates on parvovirus enteritis. It's been fun actually having a chat with you over the last few days at the WSAVA conference. I hope you found something useful from my little précis here, and not as good as the real thing, but hopefully those take-home points, kind of short and sweet. And until the next conference, we'll see you later. Bye.